So in the chat, maybe drop in your name, organization, what community you're joining us from, and if you know the treaty territory, do that as well. Let's see. Okay, and am I still muted? There we go. No, I'm not. Good. George McGregor, Next Step Ministries, Calgary. Welcome, George. And Teresa Fontaine, Pigui First Nation, Treaty 1 Territory, Pigui Child Family Services. Awesome to have somebody from First Nations. Thank you for joining us. Peter from Vancouver Police Union, and that's Vancouver, of course. Qualitative Research, Calgary Food Bank, Treaty 7. Awesome to have you, and somebody from the food bank. That's super cool. I know your CEO there. It's always voted one of the best places to work. So maybe that's something you can confirm. Josie, Treaty 7 as well. Welcome. And yesterday was our Treaty 7 anniversary for those of us here. Genevieve Funk Onrao, Clinic Community Healthy, Winnipeg, Treaty 1 and Homeland of the Métis Nation. Awesome to have you. Awesome. We'll give folks a couple more minutes to trickle in and we'll get started as well. So if you're just joining us, what we're doing is just putting in our names and organization we're coming from and our treaty, if we know much about our treaty. And if you don't, encourage you to give that a Google and get looking into it. It's super important and also really interesting history. Awesome. Okay, we got a couple more. Shane. Oh, Shane. We love Shane. Hey, Shane, Southern Alberta Brain Injury Society, Mokinsis. That's the Indigenous name for Calgary. Andrew from Edmonton Treaty 6. Brent, also VPD, Musqueam, Squamish, and Tsleil-Waututh. I'm sure, unfortunately, not doing a good job on pronouncing that last one. Thank you, and thanks for joining. All right. Okay. Oh, I did a good job pronouncing that. Thanks, Mo. Thanks, Mo. Well, I appreciate it. Awesome. Yeah, so if you're just joining us, introduce yourself. And Selena saying that she can confirm that the food bank in Calgary is indeed a really great place to work. Thank you for that. Bethany White, UWCA Treaty 7, zooming in from Okotoks. Aaliyah from Thunder Bay, Alpha Court Mental Health and Addiction Services. Allison from Calgary. Awesome. Yeah, keep it coming in the chat just so that everybody knows who's joining us, and also gives me a good idea of who's in the room so that I can make my my remarks more relevant to all of you. Chantil from City of Edmonton Neighborhood Services. Awesome. Awesome. Okay, well, I'll welcome you officially and we'll get going. This is being recorded, so I know lots of folks sign up and then get the recording later to view when they have time. It's always, of course, interesting to join live because then you get into some of the conversations that are happening live, but we also want to make it accessible to folks that don't have the time to join us live. So the webinar today is going to be focusing on some interesting stuff. We're fresh from the federal election, and we're, of course, at least those of us in Alberta are fresh from some new restrictions. So our lives are kind of turned upside down a little bit right now, but we're going to be getting into COVID recovery and city funding recalibration. So we're going to be sharing with you what we're seeing from across the country, and are going to be getting into some of the insights that we're gathering through our work and some of the trends and in some cases, some predictions that we have around what's coming our way as a sector. So those of you that are just joining us, drop a line and say hello in the chat, where you're joining us from in terms of territory, if you know your territory, your city, your organization, and your name, and we can say hello in the chat. So before we get going, acknowledging again that in the spirit of reconciliation, I'm joining you from Mohkinstsis, aka Calgary, which is a territory of Treaty 7 and Blackfoot Confederacy. Also home to Métis Region 3. And I was mentioning to folks yesterday that it was our, now Mo, you can correct me, 147 years since the treaty signing for Treaty 7, but it was our anniversary yesterday. So encourage everyone to pay attention to that. And if you're not taking the time on Reconciliation Day to reflect, then you haven't been listening. All right. So a bit about us, and trust me, this is literally a little bit because you can fill your boots on our website, but HelpSeeker is a social technology and innovation B Corp. We sit in that intersection of social innovation and technology innovation, and that's not a normal spot to be, which is really fun, creative, and crazy making sometimes, but it's great fun to come up with solutions for help seekers, for service providers, and for decision makers to make this thing we call the fourth industrial revolution be more equitable in its outcomes for the communities that we serve. Our national partners are CMHC and the Canadian Digital Supercluster, and so that's truly the social and the tech in terms of partnerships. However, we've been adopted across Canada, so we can get the benefit of those insights from the communities that we serve, because we're getting a lot of that on the ground experience and hear what's happening on the ground and all over the country. So for today, what we thought we would focus the webinar on, and sometimes our webinars are much more around thought leadership, sometimes they're much more practical. This is somewhere in the middle, and sometimes we have lots of experts and we have these panels. Sometimes we want to just have a focused discussion. So today is just me and you, keeping it simple, but that doesn't mean that it's always like this. Today, what I thought would be really meaningful is to give you guys some insights on what we're seeing across the country, and what we've been learning, implementing our solutions across almost 1,000 communities in Canada, and some of the trends that we're seeing now that the COVID recovery is at least something we're talking about. So the challenge, and again, things you may have heard us say before, but some of you are new to these conversations. In our work with the Government of Canada, we've been fortunate to develop the first ever national inventory, a dynamic inventory of the social safety net. So those are all the components and bits and bobs that we call our Canadian social safety net, and we're nice and proud of it. But what does it actually mean, and what does it actually look like? In Canada, it manifests as this humongous and complex and very dynamic, and unfortunately very fragmented network of services and supports that most of us don't even know much about. And even in our own communities, we're challenged by that. So even us as experts are sometimes shocked at how complex things are when you get into mapping them. So our work through the Digital Supercluster and the Canadian Mortgage and Housing Company has been to map all of these services and make them available to Canadians. And first, that are folks that might be new to Canada, so not quite Canadians, but live here. And so we're at about 300,000 services nationwide in our platform. But what we've also been able to do through that process is actually start to look at the flows of funding into the social safety net. And the reason we do that is because we get asked constantly about how we can optimize the social safety net to respond to backlog of needs or unmet needs in the community. And so far, we've been able to track about $280 billion on an annual basis. Now, that of course manifests very differently from region to region and by issue. So the challenge, of course, has been to unravel it and make suggestions on what would work better. The piece around this that I think is going to be really relevant moving forward, and for you as decision makers to be aware of, is that it's not just us that are asking questions around, what funding goes in and what are the outcomes that come out. These are questions that are being asked by the public, by decision makers across the country, and there's nothing like a scandal to really raise awareness around this. And the We Charities scandal that occurred last year has really raised expectations around transparency and the ability to follow the money and ultimately to results. But these are the questions on transparency are being asked by Indigenous leaders as well, to say, well, where's the equity? Who's getting this money, and what is being done with this money? Do Indigenous communities have control over the funds that are coming in to serve us and our members? So it's not just an accountability kind of neoliberal questioning of this. It also comes from an equity seeking perspective as well. That's important to consider. The things that are on the horizon and what we're hearing from about, like I said, tons and tons of communities that we're in, and things that we thought would be important to highlight today too, and reflect on them. And I have a Menti question after this, but I'll speak to these 6 signals that we're hearing from the bottom up. And the first one is the housing. That being the number 1 search in our platform consistently, and it has been before COVID, and clearly it has not abated during COVID as well. But the frenzy in the housing market, the supply challenges and affordability challenges are creating this pressure downstream for communities, and with very little relief on the horizon, because capital supply takes a long time. So the maximization of that housing access has been a consistent challenge that we hear from rural all the way up. Not a surprise, it was a major election item as well. The second one is this burnout by fragmentation. So I mentioned the 300,000 services. That is, again, going to have an impact on the frontline supports that are still operating despite COVID. So you've got the COVID pressure, and then you've got this fragmentation, and you've got this mounting frustration by people that are in the sector that is in some instances causing folks to leave the sector as well. So the same thing that we're seeing nurses vote with their feet, we're starting to see signals of that might be happening in the social sector as well, and to no surprise. The mental health challenges, the complexity of the issues, more people exhibiting needs that folks are feeling frustrated because the fragmentation that was there before COVID is still there. And while we had a burst of innovation when COVID first happened, it seems that things are settling back to the way they used to be. So that is causing this loss of hope at the frontline level, that is causing some of this burnout and walking away from the sector. Economic transformation. This is again precipitated by COVID, certainly, and what's happening in terms of the work from home, the remote trends that are continuing, and the way that the economy is responding to the COVID effects has certainly had immediate effects on the social needs of communities. So the isolation, the loneliness, the mental health challenges, the drug use, and what used to be recreational being an everyday thing, all of that is entwined. But there's also broader economic transformations that are starting to manifest, and that's around the digitization of services as well, and the transformation that's coming about because of jobs being moved more and more into the technology sector from our usual industries, the greening of the economy. All of that is creating uncertainty, tensions, and again, adding pressures. Substance use and complex needs. I was just in a session this morning with the community of Moncton on this, and a community that's relatively small with some really big challenges. So the complex needs that we used to see in the Torontos and Vancouvers is, I mean, the issues they were describing in Moncton are in some ways no different than what we're seeing in the major urban centers. And the continuums of care around complex needs, the connections between health, the health system and addictions and treatment, homelessness, poverty reduction, food security, all of that not being entwined in an effective way. And then the services themselves not being targeted or apt to respond to complex needs and being much more generalized. So the question there was, do we have the right mix of general services versus specialist services? And the answer was no. Majority of their services were very much around information and referral, general education around mental health and housing, but very little in terms of drug treatment, DBT therapies, etc. So the question becomes, how do you nimbly move your system to actually tackle these challenges and tackle them upstream effectively as well, versus just, it's not about giving information, it's having that client journey through and through. Ownership over safety, and I'm glad that some folks from the police services are here, but the ownership of safety when it comes to, you know, who's responsible to respond to some of these challenges we see in downtown core. So as less people are downtown using downtowns, you've got less so-called eyes on the street. Therefore, communities reporting that there's just more visible drug use, more opportunistic petty crime, people leaving their cars open and then things get stolen or things get jacked. That is, again, something we're seeing across downtowns and commercial areas in the country. So it's not just a you thing, if that's what you're thinking. But the other entwined conversation is, what's the role of policing in this new context? The defunding the police conversation has obviously dominated so much of this discussion. So when does police intervene? What is the role of the social sector in those interventions? And what we're hearing more and more about is how complex this issue is, because it's not as simple as saying, you know, the mental health or the social response needs to come in. What if the police calls and nobody's available because everybody closes at 4 o'clock? We hear that a lot, where our social sector isn't necessarily tooled in the right way to be part of that common response. Vice versa, police not understanding the role of the social sector and kind of throwing things over the wall and nobody picking them up. So there's this bouncing happening, but there's also some really cool stuff that I'll share with you, that where police and social sector are collaborating on some innovative strategies in this space. Then the public will around social infrastructure. So we see obviously humongous investments in some ways in the sector. And then we see promises during elections around social infrastructure, like the childcare policies, affordable housing policies. There's also this other sentiment in the public will, where it's questioning the use of public dollars for some of these issues. So, or where is our money going? Some of this transparency conversation popping up. So, well, we're having this, on the one hand, need and promises of social infrastructure. We're also having this trend emerge, questioning, you know, whether those funds are being spent appropriately and asking for more transparency on these. AKA, it's probably going to continue to manifest. So before I keep chatting, I thought what we would do is have a bit of a pulse check with you guys and see what resonates for you when it comes to these issues. So I've prepared, you know, our famous mentee chats, and if you wouldn't mind just getting your phones out, and let's see what you guys think. Ranking these, and there might be other ones as well, and we can chat about those as well. But go to menti.com and use that code 35167656, and let's see which ones of these are ranking for you. There might be other ones that we haven't heard about that would be cool to learn from you more on. So let's go to the menti.com and see what you think. we'll give everybody a chance to rank them according to your order and see if we got it right. Okay, and in the meantime, I'll say a couple more hellos to folks. All right. Okay, as these come in. Chantel from City of Edmonton, Allison, Windsor, Vancouver, Shade, Nicole from Victoria, Taha, Revelstoke, Matt, hey Matt, Homeward Trust. Look at that. Substance use popping up, housing. Oh, burnout by fragmentation, ownership over safety. Yeah, keep it coming. Let's see what pops up for you guys. Interesting. We'll give that a couple more seconds. Looks like we got a solid lead by the complex needs conversation for sure. Okay, so now for those of you that put other, while the rest of you vote, for those of you that put other, throw in there what else you're seeing in terms of number 7, those other items, if you wouldn't mind just throwing it into the chat, and I can read them out to folks. Certainly looks like we've got most of the trends resonating with all of you though. Competition, look at that one. Thanks, Shane. Competition among nonprofits for funding. So yeah, that makes sense. So this whole transparency, outcomes, less money being out there, or questions about where the money's going, creating competition. Gangs, guns, crime, so safety, public safety. So it might fit under ownership of safety, but it's a bit of a different angle for sure. So I'm guessing, Aaliyah, that challenge is one that probably merits its own category as something that's increasing from your perspective. Okay, if anybody else has other things that are not on this, would love to see those in the chat if you don't mind, but don't feel like you have to. So yeah, I would definitely agree that competition among nonprofits for funding is it makes sense. There's more questions around accountability, and there's less so-called money to go around, or less scrutiny put on the money, so that will endanger more competition for sure. Awesome, thanks. Oh, there we go. Taha says funding expectations built up by emergency funds. Ooh, that's a good one. So we had this influx of COVID dollars with very, very different strings attached. There's actually been quite a few new programs that have emerged during that time, yet those funds are not going to be here longer term. So that's exactly what we're talking about today. So that's exactly right. So there's this expectation, yeah. And it was incredibly flexible, and it was great, wasn't it, Matt? Because there wasn't the same kind of administrative burden on that money that we have in our regular programming. And when we like that, so we were able to do things we weren't able to do before. But now there's certainly this pullback on that money that's going to be hitting us very shortly. So how are we planning for that? Are other programs going to absorb that role? Are we going to retool them to take that on? Are we able to retool what we currently have to be more nimble? I think the top 3 are consequences of the bottom 3. Good one, Beth. Yeah, so public will for social infrastructure, economic transformation, and ownership over safety. Oh, that's a beautiful insight, Beth, and very apt. Very apt, absolutely. Fragmentation causing inefficiencies in the delivery of services. Absolutely. Peter says this as well. Yeah, these are, of course, chicken and egg. They're all part of, back to the beginning, that social safety net not being optimized as well. So then the question becomes, how do we get there? Because we keep talking about this magical reset that we're all supposed to be really excited for, but we're not necessarily doing anything about it in the way that we should be. So going back to the presentation, if I can find it. And where did we have that? Sorry about that, folks. If there's any other kind of takeaways from this piece that you wanted to share in the chat, by the way, just make sure you drop it in there as I pull up my charts up again. There we go. So by far, what we're hearing about more and more in terms of action and priorities for government is again what you see here. So this converging of factors manifesting on the ground. So the addictions and substance use, and it really is exactly what you all identified as the number one thing, the complex needs, which is all of these pieces coming together in urban centers, but also smaller regional centers as well across the country. So it doesn't matter whether you're a community of 50,000, 30,000, or 1 million. These challenges are popping up more and more and are becoming much more visible today than even before the pandemic. And I don't want to tell anybody that it wasn't visible, by the way, because it was extremely visible before. It's even more visible now for all of these reasons that we talked about before. So safety, migration into urban centers seems to be popping up more for complex needs as well. What's driving it, you probably know that better than us. Domestic violence, more health and mortality, and homelessness. So all of these pieces converging more and more in these intense and visible challenges. So again, you're not alone. The question becomes, what do we do about it? So a couple of not thoughts, but methodologies that we've seen and these are just our vantage point. You can take it or leave it, but some of the pieces that we've been involved in systems that have tackled these issues again at a systems level. So, and doesn't matter what you use and how you do it, these are steps that we consistently see needing to be taken in some kind of order. So it doesn't have to be the first or the last, but at some point you're going to have to do these steps if you're going to reset or optimize your social safety net in your community. The first one, and we always start with this, is systems mapping. Obviously you can't change something you don't understand. So having an actual inventory of who's doing what and what they're delivering is a humongous asset, and you can't underestimate it. You have, obviously we recommend using dynamic inventories to do that. We have ours, you don't have to use it. The government paid for it, so you should use it because it's already there if you're not using it. But that systems mapping component is absolutely essential. You'll be shocked to see how many services you have in your community. Most of the time, people have no idea that there's that many players. So the point from Shane around competition, of course there's competition, there's a lot of players. So the question becomes, how do we bring them together in the most efficient way? So to do that piece, you need the next step. And again, do it however you want to, but I'll describe what these things are and we can get into more detail. The social impact audit is really the analysis of financial flows into your social safety net. So is it primarily coming from one funder or two funders or five funders? If you understand that, then you know where you fit into the scheme of things. And for those of you that are funders in this, or even service providers, it's a 101 thing. Like, you can't be an effective funder if you don't understand what part of the social safety net you play and where the other investment pools are coming in from. Ideally, what you're able to do in a social impact audit is trace the dollars into the service delivery system. So there's a huge, let's see if I can use my little pointer. And I don't know that I can. No, I can't, because I'm not, even though I run a tech company, I'm very tech unsavvy. But the social impact audit and the systems mapping, they're married. They should be married, or at least have a common law relationship that's healthy, because you need to be able to trace the money that's coming into the safety net into the service system. And this is another KPI that we always look for. And I'll give you an example. One community, we were able to trace 90% of the money in the system to service delivery. In another community, we could only trace 40%. Well, that tells you something. And so is there a repurposing of funds that could be done so that we can get more boots on the ground in terms of frontline delivery? in that context. This is also where, if you're understanding where you benchmark across communities, so if you have like a saturation of one particular type of service, let's say you've got tons and tons of food services, and you've got very little in terms of addiction treatment, and your number one thing in terms of a community pain point is complex needs, not to say you shouldn't do food, is just to say, well, relative to our priorities, and if we know what the money is coming in, is there a way that we can shift and recalibrate the funds to that? That's easier said than done. I get it. I really do. But that's the work. That's the work that we have to do. That's the system that's agile, that's responsive. The worst thing we can do is say, well, we've always done that. We've always funded that. Well, it's COVID, guys. Like this is the opportunity for that recalibration and this reset into a more agile response system. So that's the social impact audit piece. Lots of resources on that, lots of blogs. I'm happy to answer questions on it in the Q&A piece, but essentially it's tracing the money and then tracing the money ideally to the systems map. The impact component is interesting because we've done the impact part to look at outcomes, and oftentimes the outcomes are not they're not visible to us as researchers. So I'm not saying that they're not happening. I'm saying they're not visible at a systems level. Again, that tells you something. If you have the list of everybody and how much money they're getting and all their funders, all those funders are demanding outcomes. It's a matter of collating them, putting them together, and analyzing them as a sector. That becomes the next step. That is also related to this other part, this whole demand forecast. We have amazing numbers, we have amazing researcher, we have amazing data in the system, but we're not using it to actually get ahead of these trends. We're always one step behind. We're always reacting. Case in point, the majority of our priorities were things that were symptoms, as Beth was mentioning, of other underlying issues. So the demand forecast is actually looking at your ecosystem and predicting to the best of your ability, and it's always going to be a moving target, but just like we do in every other area of our life, looking at scenarios and saying, well, if we know this is happening in the economy and we know there's a correlation between this and that, how many affordable housing units will we need? How many mental health program spaces will we need for this population versus that population? And actually doing your demand forecast as a ecosystem all together. So all of your funders, all of your system players participating in that. Now, not everybody does the number crunching, but you come together and look at those and make decisions as an ecosystem. That also comes into play around performance modeling. So a systems planning work requires you to be vigilant about an agile response, and that means you have to have a performance management process in place. That means your data has to be real time at the program and client level so that you can track whether what you predicted and what your targets were in terms of social outcomes are being realized or not, and then to right tool your system if that's not happening. Again, easier said than done, but I can also tell you where communities that do this is where you see traction and where you see impact. And I'll give you some examples in a second. The last piece is this investment strategy. And I always encourage funders and decision makers in the sector to look at this as a portfolio and look at their component of a broader portfolio and where they fit into it. And the reason for that is that oftentimes funders focus on they might think that they're responsible for the entire ecosystem, or they might think that they're responsible for only this little part. Ideally, you have your funders come together in a funders forum or funders table that creates an investment strategy together, and each of them walk away with their pieces. But then their performance modeling occurs at a systems level so they can track how their investment aligns with those community objectives. I know this is like hard to do. I get it. I've been a funder before, and there's the same way that there's competition among service providers, there's actually tons and tons of competition amongst funders as well. So that requires the decision makers to be open to this as well. but that doesn't mean it's not doable. So I wanted to spend a couple of seconds on giving you some examples of why this stuff is important. And I'm giving you an example here of data that is publicly available. In other words, you can fill your boots and use the data that you already have available to understand this. But look at, and I highlighted Kelowna there, but look at how different cities are, in terms of their investments. And the point I'm trying to make here is that, you can't just assume until you actually do the heavy lifting and do the work. And the next part is that we need to understand the relationship between how much money is coming into the system and the outcomes we're getting for it. But the first step is to understand these financial flows. I also wanted to give you another example of cities that are moving in this direction. And again, you can probably guess from some of these who the city is. And the story really repeats itself. It doesn't matter where, but in the case of this community, the city's allocation, even though it was significant, it was about $25 million annually, it only represented 2% of their funded agencies. So I'm not even talking about the entire system of the portfolio of agencies they were funding. The city's allocation was only 2%. So what can the city expect, or what is the best leverage of that $25 million to influence the other 98% in the right direction? And that's how we need the decision makers and the systems planners to think moving forward, is at that ecosystem level. For these guys, Government of Alberta, as you can see here, was the big kahuna, right? But that becomes a really great opportunity, because what you can do is actually drill down. And in this context, I didn't put this slide up, but we actually identified 3 specific departments that were the key, and we engaged them in the funders table to do their work differently. So instead of duplicating, you're aligning and leveraging. So then you're able to identify gaps and fill the gaps rather than just doing business as usual. There were so many RFPs that were active in this community at the exact same time that the funders hadn't checked with each other ahead. It was, of course, up to the agencies to figure out the mess and see what this guy wanted versus what this one wanted, and come up with something that kind of met their needs. Like, let's get the funders to get their houses in order and get aligned, because that we're never gonna get out of this muck if they don't step up. So same thing here. When it comes to that comparative lens, I encourage you to look at communities from that comparative lens across funding streams as well. So how do you benchmark in one community around particular issues or particular needs? And the whole point is to say, is there a sweet spot in our community right now, and what does it need to look like in the future? So again, I'm giving you examples of things you can do with open data, because I know it's costly to do a social impact audit and with the full gamut, but there's still lots of things you can get out of doing this with available data sources. And again, the point here is that these differences matter, right? They matter when it comes to outcomes. So you can see here the variance between, let's say, Vancouver and Edmonton when it comes to youth services, for instance. And is that related to some of the outcomes we see for young people in Calgary? The other reason for doing this, and again, another example from another big city, when you can actually look at these pieces at an ecosystem level, you can start to look at opportunities for integration and optimization. So this is a pretty large city, but if you look at the needs and the integration of those needs, so you're no longer looking at, let's just say, housing and homelessness by itself. You can see that all of these issues, they cluster in the population in some pretty predictable patterns. And again, this is just illustrative. I'm not telling you this is for your community. I'm telling you this is an example to consider. And oftentimes we don't right size our ecosystem based on our needs, or what we really like to do is say, oh, addictions, I'll just pick on that. I'll just focus on that, not realizing, or not that we don't realize it, but we know that the intervention needs to be holistic and person-centered. So we go after addictions, but then we don't talk about housing, we don't talk about domestic violence, even though when we look at the profiles and the needs of these individuals, it's all of those things. So the responses, the interventions, right on this side, need to consider the holistic needs of the person and be right-sized and right tooled in terms of the demand, right? So having that demand estimate is a huge component of this. Can I share the data for CRA? Oh, just go to CRA. It's open data. Recalibration opportunities. So here's an example. So once you understand the demand, and again, reminder to also predict demand into the future, you can then say, well, here's my systems map, here's my social impact audit. So here's what I got, here's how much I'm spending, here's what's coming my way as a city at a holistic level in all of these categories. Do I have enough money? Right? And, or if I move my money, will I have enough money to actually respond? And you can see in this community, there's actually enough money to do the job if the money is targeted to the right things. So it's, again, it's not saying that this is the be all end all, it's to say, is there a better way of using the funds that we have if we target these components holistically and in an evidence-based way? And the answer, I would say, is, of course, ideally yes. Now, a couple of things, because we are talking about municipal leadership and community leadership, and some of you might be coming from city departments, some of you might have influence with your municipalities as well. And we often get asked, well, if the cities are only this tiny percentage and it's really the provinces and the feds that are the big players, or major donors that are big players, what can we do? And I think that's a common challenge for any decision maker or major service provider that only has influence and not a decision-making power. Municipal leadership can absolutely push this alignment of resources forward. So beating this, the pots and pans around this is a huge component. So bringing evidence from other communities that are moving in this direction is a huge opportunity. This estimation of social infrastructure demand holistically relative to needs. So this whole thing, you can do that piece too, and challenge the funders, challenge the decision makers to look at this from an ecosystem perspective versus an issue by issue perspective. Otherwise, you're never going to get at root causes. The complex needs partnerships. Otherwise, we're not going to make that palpable and tactical difference on the ground, that being a priority, which, and I'll tell you a couple of examples shortly, but strengthening those complex needs partnerships, specifically policing mental health addictions and social care for folks that have that complex needs profile, is huge win, and should be a huge priority for all of us in that space. And then this strong and accountable referral network. And I'll tell you the example that has really come up just in this last week, has been being invited into some of the police complex needs meetings that they have internally, and asking the question, well, did you make a referral of that person, because they've got domestic violence, they got addictions, they want housing. Were those calls made? And police saying, we make the calls all the time, nobody answers. So that's, of course, a sign of a referral network that needs a very different accountability structure. Is it that our funders are saying, you have to prioritize using this list versus that list, and therefore we don't answer? Is it that we only work until 4 o'clock and we don't have 24-hour services? So what's happening there? There's a disconnect, because on the other side, we've got, and I come from the social sector, so this is my space, but the social sector is saying we can do a better job supporting some of these responses in a more socially driven way. So there's something amiss there that needs to be resolved. So the path forward, at least in my mind, has really been, and what we're driving here, is human-centered design meets agile development. And human-centered design, of course, you know about this stuff too. It's person-centered policymaking. We talk about that. Person-centered care. So not just dissecting the person to the issue that we think they need. It's actually meeting people where they're at and wrapping supports using that well-being model. Agile development comes out of the technology side of our world, but it talks to us about the need to be extremely nimble, but very rigorous in that nimbleness. So working in sprints and epics versus these really long planning cycles. And in my sector, again, social, we're notorious for plans. And I think somebody said today that it's 90% planning, 10% acting on that plan. And it should be the other way, right? What do we do in municipal policy? We issue an RFP, we hire a consultant, we then do a consultation, we bring the report to council debates it, sends it back for a bit, and then it's time for the next election, and now the plan is old, we got to start over. It's, great plan. No, other way around, right? 10% planning, 90% action, working in sprints, make it real, make it count, right? So evidence-led, 2-week segments of work that actually tackle these challenges in a nimble and action-oriented way. You iterate every 2 weeks, you reflect, you continuously improve, you go back out again, and so it goes. And that's where this approach works really well when you act on it. If you sit on it because you're waiting for this perfect plan, it's never going to happen. Here we are. So I would really encourage you to look into Agile if you're not familiar with it, and human-centered design as an approach. The concepts in terms of social innovation, and I'm giving you some examples of, again, another community that we're working with that's moving on some interesting stuff. But they have this amazing, and I wrote it, so I love it, but who cares? It's a great plan, but it's got these really big concepts, big audacious goals, awesome for a 5-year strategy. All the demand, all the social impact audit, all the stuff is in there. But what's happening today over the next 2 weeks, over the next quarter? What are we going to be working on? And here's the 4 things that this community is tackling. And they've identified, working on complex needs as one of their priorities in their big strategy. But what are they going to do in the next 3 months? So they've got 2 pods, action pods, that are coming together to tackle these issues. One is working on a complex needs blitz. So it's the housing, social health supports, and getting end users connected to housing and supports that are already available in the community, and working using some of the relationships that they already have with their police force to do that. So rather than police intervening and doing an arrest, it's sending in the mental health addictions team to do housing, wraparound supports, and get people off the street. This top 20 that has been identified happen to be constantly in the system, getting discharged, coming back in again. And interestingly, because police is part of this project, we know that I think they're responsible for something like 60% of the downtown activity in terms of negative impact. So by prioritizing this group, not only are they getting better service and better housing and social outcomes, but it's also relieving some of that pressure on the downtown. Another thing that they're doing, which sounds so silly, but interesting, there's huge growth in opportunity petty theft, and the pandemic has caused some of this for sure, because there's less eyes on the street, etc. But they've identified that 50% of the petty theft, which makes up a huge amount of the crime being active in the city, was caused because people don't lock their doors in the city. So yeah, 50%. So it's not always intervening with these complex needs, costly interventions. It's, in this case, they're doing a digital campaign tracking that, and it's sprints. So we're not waiting for a year to do this. We're doing it, we're measuring it, we're targeting certain neighborhoods, seeing what happens. Help navigation training. So another thing has been police getting called to schools, to domestic violence calls, and them not having anything to refer people to. So this is an interesting one because, again, in this community, 6,000 service elements that are active in the city. Because they have a systems map, they can now leverage that. So the application that we're using, and it's our application, so it's a total plug for us, but HelpSeeker has this stuff as an app. So let's train the police officers, so when they're on those calls for nuisance, for mental health related pieces, they're able to make referrals and leave behind a resource for those folks that they're getting called out to, because they don't necessarily know all those services. The other piece here too, though, has been, folks saying, well, there's lots of stuff out there, but they're not always the right services. So how can we get the services to be more responsive? So we're doing a campaign here to vote for your favorite service delivery partner, and then highlighting those with badges on the app, like a star badge, etc. So that type of stuff can create, again, a network effect in the community. And I know they're simple things, and they're not going to solve your root causes, but it's back to this agile piece, right? We have to start with these tactical pieces, measure them, see if there's probably going to be unintended consequences to all of this stuff that we need to be agile and nimble and get on top of and monitor. So that's the whole concept, is let's make it tactical and tangible. So here's some of these pieces. So let's see where we're at. 50%. Okay, of our time. Okay, yeah, just looking at my time. The other piece too is, how do we speed this up using technology? So there's navigation apps. I told you about ours. We know that there's other ones, and you can use whatever, but whatever you use, see if you can streamline using technology, because there's no point in having all this innovation if nobody's using it. So navigation apps are great for it. Systems maps, again, if you've developed systems maps, putting those to use in your tactical work, I would highly recommend. Financial flows tools, so tools that actually monitor the funding and can actually forecast funding as well. And again, the performance modeling there's tons and tons of work that's from other industries that can be applied here too, so you're not necessarily starting from scratch. And then demand simulation, so AI, machine learning, all of these things that we're scared of. Take away your academic hat, put on your get things done hat. What tools can you use to speed up the work so you can get to action faster? Of course, with taking into account all of the good quality that needs to happen in terms of thinking and planning, but don't let that stop you from taking action. So with that, I think I had another Menti, but what I think I'm going to do instead, just in the interest of time, is see if folks have any questions, and I'll go to the chat for that. Okay, and that last piece was also a little forecast to our next webinar, which is using machine learning for good. So using some of these AI tools for social transformation and actually digging into what that means in your day-to-day life, because I know it's easier said than done. So chat, let's see what we got. Okay, Chantil agreed. I would add that we need to reignite the role of community in informal care, neighborly relationships. Absolutely. Yeah, so those natural supports, it's not always going to be a formal system that is required. Same thing, using that and leveraging that is a huge win. And so Selena's saying that she wishes there was more focus on preventative and early intervention, given the adverse childhood experiences compounding with traumas early in life. So again, what can we do in the immediate term to tackle that? I give you an example of this one community where complex needs was the #1 priority for them to tackle. They have other priorities. Adverse childhood experiences is another one. Same thing. There's these tactical responses that we can put into play right away, measure them, and then scale them. Okay, what else do we have here? If I just saw something come in at the bottom. Yeah, can you speak a bit about what performance modeling looks like for a funder? Oh yeah, sure. That's like my jam. So performance modeling looks at, on a program by program basis, you have the ability to obviously follow your investment through the service delivery mechanism and actually see what impact it has in terms of outcomes. But then you're able to aggregate all of the programs into your software and spin out, forecasts moving forward. So if my goal is to, let's say, tackle all youth between this age and this age with these interventions, and I have this much capacity that I'm funding, by what year will I achieve that? I'm also able to monitor the performance and track the performance in terms of outcomes. So an outcome might be, that the youth exits out of that service with better acuity scores, right? So a well-being pre and post would be there. Another one might be looking at somebody that's homeless today but is housed tomorrow, and what flow through do we see between the current state and the future state. So does it take 3 months to get there? Does it take 5 months to get there? Does it take 2 years to get there? If you understand the flow, then you can forecast when you're going to hit your targets in terms of outcomes. And that's what performance modeling software should do for you if you're structuring your investments in the appropriate way. I want to tell you about this one example, and we're starting to work outside of Canada, which is totally mind-boggling for HelpSeeker. But I was chatting with a partner in Ireland that works with natural support. So I'm going to speak to the prevention question earlier and the role of informal carers. In Ireland, 12% of the population there is involved as a carer. And a carer means that you actually have a kind of a more formalized responsibility for somebody that you're supporting, and you're not getting paid for it. So the amount of work that goes in is valued at, I think, $19 billion, euros, I should say, in that community. But what Ireland is doing very successfully is that they're mobilizing this natural supports network of these 500,000 people in a country of 4.5 million. So it's actually pretty significant. That are involved in some aspect, and they're training and building their capacity nationally. So there's regional pods that do this work and build their networks of referral, and that's where we're getting involved because of the digital navigation. So they don't have a systems map in Ireland, and they're finding that a lot of their natural support spend too much time trying to figure out where to send or where to get supports for their loved one or the person that they're caring for. So how much time could we save? And of course, it's like ridiculous, because it's a no-brainer from a return on investment perspective that having some of these tools is going to save tons of time that they can then spend doing something more meaningful. But their work has been to really build the capacity of these natural supports systematically. So rather than everything falling on the formal social sector, you're building capacity for people to support each other in the broader network. Obviously, that requires a very different thinking for us, right? Because we don't typically do that. So instead of serving folks only, they do serve, obviously they have a social response system, but they also have this broader network that's integrated with their social workers to do that piece. And the cool part about it, again, working in sprints, they did an agile methodology, because this is how we connected. They work in 3-month sprints. So they said, if it takes you longer than 3 months, then you're probably not doing something right. They do a well-being assessment at intake and one at 3 months, and considerable impact has been realized using this well-being model of basic needs, housing, food security, education, employment, all of this wraparound stuff. They train the carer to be more effective in supporting their loved one, but also caring for themselves, because there's so much burnout when you're a carer, and then tracking the outcomes at the end. So tons of reasons to do that and to leverage the natural supports network. And it works whether you're dealing with complex needs or some of this preventative work. That methodology around systems planning works regardless. All right, kinship care from an Indigenous perspective from Mo. Yeah, absolutely. Caring for all, and yeah, absolutely. It aligns with this concept of kinship care and building capacity and resilience and less reliance on the formal sector. Okay, any other questions or any other thoughts, things that weren't clear that you guys would like me to touch on? Why is addiction treatment always underfunded? Okay, good one. That's actually a very interesting question. When we look across Canada, and again, we have this benefit of this humongous systems map now, so 300,000 services. You're right. We tend to err on the side of these generalized services when it comes to addiction, and at least in the nonprofit sector, and then we leave the specialized stuff to the health systems, and it's not as important as the emergency, the acute care. So if you look at public health budgets, it's a very small amount that goes in there. Why? There's probably smarter people that can answer the history of addiction treatment and how entwined it is with our ideas about deserving and undeserving. But ultimately, we've created this lag in our treatment capacity given the demand. The wait lists are exorbitant, and if you don't have the space, then how are you supposed to be responsive? I would also say that we have potentially an opportunity to repurpose some of the resources that are going into some of the more generalized services to see if we can shift those towards more of the treatment and more therapeutic interventions when it comes to this population. So I would say if you're active in that space and you're noticing that maybe everybody that's coming to you is coming for information about treatment, and all you can do is tell them about treatment, and it's a giant wait list, can you shift your service to actually provide some of those services? Is it that you need different skill sets? Is it that you need a different facility? But if all you're doing is shuffling papers or making referrals, that's probably not going to get to the root cause. So I know that's not an easy thing to do, but having that conversation with funders or the funders asking themselves that, are we delivering services, or are we delivering referrals? Because those are different things between an actual direct intervention. And I'm not saying referrals are not important. I'm just saying we can't only do referrals. We also have to do some of that heavy intervention work at the same time. All right. Any other questions? In my experience, people who find housing with a supportive community addictions decrease totally. So again, using that well-being model, right? And we're going to do a future piece on the well-being component, and we'll get our Irish partners in the room because they've really scaled this nationally and are showing some excellent results. But rather than dividing the person and saying, well, that's your addiction thing and you go over here, and that's your housing thing and you go over there. No, build a user-centric system of care and use the user journeys to create your interventions, not the other. Don't make the person fit your system, make the system fit the person. So that means the way we bucket our services needs to change. And if you notice now, I'll give you the example from my friend Jamie Rogers in Medicine Hat, and I can't take credit for it, but she rightly made this analogy, and we always laugh about McDonald's. That you can go to McDonald's and you can get your bundles of you can get your Mac combo A, B, or C, and you can get Diet Coke, and you can kind of customize, but those are kind of the buckets. And it's like that too for the way we've structured programs. If you think about it as a funder, what we do is we say, we're going to fund this program. In that program, though, on average, a program delivers 5 to 6 different service elements within that same program. Now, what if the client only wants one of those service elements? We're like, I'm sorry, you got to take them all. You got to get the whole bucket. You don't have to eat you don't have to eat the fries. You can only have the burger, but we're going to give it to you anyways. So that, of course, is a really inefficient way of doing things, and the client doesn't really want to eat the whole meal. So if we can think of it from an a la carte perspective, can we remove this concept of programs and look at service elements, and then look at what service elements consistently get asked for versus programs, and then restructure around those service elements in a more user-centric way? I'd say that's the future in terms of system reform. If you're interested in that, Medicine Hat's system transformation project is definitely the go-to for really tackling this across the entire ecosystem of thousands of, I think 2,000 different services that they have there. And then you can really see where you lag, because again, back to that analogy of the a la carte service element, is that the client is asking for housing. Well, are you giving them a pamphlet about housing, or are you actually giving them housing or a rent subsidy, right? Same as food. Are you telling them about healthy eating? Are you actually doing a community kitchen? Are you giving them food vouchers? What exactly are you actually giving people? Until we can have a systems map that talks about the service elements, it's all just fun and games, right? Because then we will never know where the backlog in demand is, because we're always guessing based on these more generalized categories. So it's getting really, really tactical and practical about these issues. How do you track qualitative impact of funding? These days, funders fuss too much on quantitative outcome and drive frontline workers to focus on immediate service only, and no time or interest in the holistic improvement of the client. Oh yeah. So it's the holy triangle, right? So you've got the funder, who's the buyer. You've got the client, who's receiving the service, and then you've got the service provider who's delivering the service. Right now, the conversations are happening between the funder and the service provider, right? And we rely on the service providers to represent the client, and then we rely on the funder and their understanding of the client to direct funding appropriately. And of course, in our usual, patriarchal selves, we talk about person-centered care, but in our systems planning work, we don't do that user work very well. I'm not calling anybody out, but the way that we do user interviews kind of after the fact, I've done them so much, and I've heard, but I haven't listened. And that's been another big learning that I've had going through the technology sector side, because it doesn't matter what Alina thinks, even though I'm supposed to be this great expert. We put things in front of people, and if they hate them, who cares that Alina thought it was a good idea? So this tyranny, insisting on the tyranny of the user, like that trumps everything, right? And again, are we doing that really? And back to the qualitative component. I get so much backlash when we talk about adding accountability around service experience to the navigation app, and the biggest complaints came from service providers that they're like, well, we don't want to know what service users think of our service. Like, well, how are you supposed to make sure you're better? So I would say that's kind of a challenge to all of us, right? As funders and as service providers, we hear it, but are we listening? And again, I'm like the number one guilty of it, and I'm learning because I'm seeing the results at the end of the day. Because if you design something that is usable and valuable to the user, you're going to have way better outcomes from that. And then the user is not this after fact, like, oh yes, I'm supposed to do a qualitative report because I got to have some good stories for my annual report. That's not the point. The point, back to the agile planning, having the user drive the user journey being at the crux of this work is the magic at the end of the day. So again, reflect on what that means for your organization. I'm sure it's very different. A good example from my friend and that as a food bank CEO, this whole concept of, rather than feeling disempowered and shamed when you come to the food bank, flipping this around and making it a community food center where there's activities, where there's learning, where you get the food from by yourself, you're able to choose what you want versus kind of constantly being relegated to undeserving or being ashamed of being there. It's just the little things that you get by listening that make a big difference. All right. Okay, I think we're a bit over, but if there's any other pressing stuff, I'm gonna just take a look at our Q&A, make sure. Okay, and we got that one. So we're good. So again, I wanted to thank you. I know this was a much more technical discussion than we usually do, but I think a worthwhile one to reinforce what we're learning from the communities that we serve, and bring that back to all of you as leaders in your respective work as well. So look forward to seeing you next time. This one's going to be very data science-y, but fun at the same time, because we're going to demystify what these algorithms are and what they do, and how they're being applied in social transformation efforts across the country. And yeah, maybe we'll see you there, and if not, we'll make sure you get this stuff through recordings. So thank you once again very, very much. Very nice to see you all, and would love to hear any feedback at any point, or engage with us on social media as well. Thank you so much, and yeah, have a great rest of your day.